Do you ever stop and think about how much you love your eyes? Probably not. If you are like most people, you probably take your eyes for granted. You put your eyes through the ringer, and still, your trusted friends are there to show you the way. But maybe you have been thinking about getting LASIK or having your cataracts removed, but the thought of eye surgery frightens you. We understand. That is why our #1 priority is you and your eyes. With over 30 years of experience, Eye Associates is one of the country's most trusted eye specialists. The doctors at Eye Associates will make sure your eyes are cared for, and our friendly staff will go out of their way to make your experience peaceful and stress-free. Don't be confused by cheap imitators or too good to be true offers. Call Eye Associates and schedule your consultation, because your eyes deserve the best.
Hello, and welcome to Eye Associates' Focus on Healthy Vision. Today, we'll show you some of the amazing procedures performed by Dr. Sydney Tyson at Eye Associates. We'll meet patients just like you with success stories about how proper vision care changed their lives. During this program, you'll have a unique opportunity to witness Dr. Tyson perform surgery live. You'll meet patients that have had cataract surgery, and you'll find out how Dr. Tyson and his team at Eye Associates can help you to see better. Welcome back. Before we go on, let me take a moment to talk about Dr. Tyson so you can learn how he became such a qualified and accomplished caregiver. Originally from Brooklyn, New York, Sydney Tyson had dreams of being a doctor from a young age. He began to realize those dreams when he was accepted into the University of Pennsylvania. He graduated in 1982 with honors with a degree in biology. From 1982 to 1987, Dr. Tyson attended the world-renowned Harvard School of Public Health, where he earned a master's degree in public health as well as his medical degree from Harvard Medical School. Soon afterward, he started his internship at Pennsylvania Hospital in the Delaware Valley and his residency at Wills Eye Hospital in Philadelphia. At Wills Eye, Dr. Tyson made a commitment to share his knowledge and understanding with the new generations of doctors as a teacher. And while continuing to be one of their top attending surgeons, Dr. Tyson has authored and edited several book chapters and articles in his specialty and has won numerous awards, including the Top Doc Award given to the top 100 surgeons in the United States. He is board certified and currently a member of the prestigious American Academy of Ophthalmology, as well as many other organizations. As you can see, Dr. Tyson is a dedicated eye care specialist and is known nationally as an authority.
This is an exciting time in ophthalmology, and in this program, I'd like to share with you some of the outstanding advances we've had in the field of cataract surgery. In particular, I'd like to share with you some of the lifestyle benefits achieved with these new technologies. A large percentage of these new advances have occurred in the field of lens implants. We are now able to offer patients our premium lens implants, which allow them a full range of vision, from close to far and everything in between. In fact, with the customization options we have available, a large majority of our patients don't even need glasses after cataract surgery. So stay tuned, and we'll share with you some of the success stories that we've had with these new premium implants and customized cataract surgery.
At Eye Associates, we believe the best way to understand how our advanced techniques can help you is for you to hear from our patients firsthand. So, first up, it's Barbara from Ocean View. Barbara's had advanced cataract surgery with our customized premium lens implant option. Her surgery has changed her life, but let's let her share her own story.
Dr. Tyson put in the restored lenses when I did my cataract surgery. When I first opened my eyes after surgery, I started to look around and I saw my sister. I could not believe it. I could actually see her without glasses. When I wake up in the morning, I used to have to find my glasses to look at the alarm clock. Now I wake up, and for the past 4 years, and I just open my eyes, and it's just, I still am overwhelmed every day with the fact that I wake up in the morning and I can see. I don't have to search for those glasses. I don't have to look for a pair of glasses to find my glasses. And the satisfaction is just a miracle to me.
Barbara was a fantastic patient. She received a multifocal specialty lens which allows her to see distance and up close. And frankly, for most patients, it's a very scary prospect to have cataract surgery. Barbara was no different. But in the end, she was extremely happy. And in fact, she was so happy that she actually volunteers her services to talk to other patients about the whole cataract surgery process. And for me, that's a great honor.
When I was here, I was so impressed with what he had done after I had the surgery. And what I said was to Dr. Tyson, I said, you know what, anytime you do a commercial or anything, I said, I'll be more than happy to do it and counsel people. If they're apprehensive, I will talk to them. And that's what I've done since 2009. I've counseled people that are going to have the surgery. I do not work here. I do it because I was so happy at the end result that I wanted to help other people to feel the same way I did.
As you can see, Dr. Tyson and Eye Associates not only care for their patients, but also get results. Feel free to call now and schedule your appointment with Dr. Tyson and his team to take the first step towards a better life and healthy vision.
Do you know when you should get an eye exam?
Is your life a bit out of focus? Dr. Tyson and his team at Eye Associates can help. Call today and make your appointment. 800-922.
Do you ever stop and think about how much you love your eyes? Probably not. If you are like most people, you probably take your eyes for granted. You put your eyes through the ringer, and still, your trusted friends are there to show you the way. But maybe you have been thinking about getting LASIK or having your cataracts removed, but the thought of eye surgery frightens you. We understand. That is why our #1 priority is you and your eyes. With over 30 years of experience, Eye Associates is one of the country's most trusted eye specialists. The doctors at Eye Associates will make sure your eyes are cared for, and our friendly staff will go out of their way to make your experience peaceful and stress-free. Don't be confused by cheap imitators or too good to be true offers. Call Eye Associates and schedule your consultation, because your eyes deserve the best.
Even if your vision is fine, you should get an eye exam annually. Seeing an eye doctor can help prevent some problems before you even have symptoms.
Welcome back. We're here at Dr. Tyson's Eye Associates, and Gina, administrator of the Surgery Center, has just given me an exclusive behind-the-scenes tour. The Surgery Center at Eye Associates is over 7,500 square feet, custom designed by Dr. Tyson and his team to focus on patient comfort and surgical excellence. It is a warm and friendly setting where you get the personal attention you deserve. When you arrive for your procedure, you enter the Surgery Center and can relax here with your companion or family member. Free refreshments and Wi-Fi are available at your disposal. The Surgery Center features a state-of-the-art surgical suite where your procedure will take place, comfortable pre-op and recovery rooms, and even an area where your companion or family member can actually watch the surgery as it is happening. And when your procedure is complete, you even get a DVD so you and your family can see it.
I feel it's really important for my patients and their families to not only get the best quality care, but also be comfortable while receiving it. So patient education is important, and we take the time to make sure that all your questions are answered, and you know exactly what to expect from start to finish.
It's great to hear about everything Eye Associates, the Surgery Center, and Dr. Tyson have to offer, but results matter most. Carmen is from right here in the Vineland area. Let's hear her story.
When I came here, Dr. Tyson did the surgery for me. All his staff treat me so good. But Dr. Tyson is the greatest. He's the greatest. And the day that everything was done after he did it and I looked, everything was different. I could see the light don't bother me. I could drive and do my stuff. I'm not afraid no more. When it comes to your eyes, you don't play. Your eyes are very important. So if you want to see, to have a nice pair of eyes, let me tell you something. You should go to Dr. Tyson. He would help you because he helped me. He's the greatest.
Carmen was fantastic. She had a monofocal lens which allowed her to see great distance vision. And she was so appreciative of her vision, she's been telling all her friends, both in her church, her family, everyone, about her great results. And what made me feel so happy about this whole process was that I was able to communicate with her in her native language of Spanish. I speak Spanish, my staff speaks Spanish, so that gave her a level of comfort that she was not able to find anywhere else. And that makes me very proud.
Debería de ir a ver a Dr. Tyson, porque Dr. Tyson es un doctor, primeramente, que él tiene carisma, tiene cariño, te trata bien, él es dulce. Todo el mundo sabe que Dr. Tyson es el mejor doctor de Baila. Él es el mejor doctor y yo se lo recomendaría a usted porque yo sé que no se va a arrepentir.
When we come back, I have an exclusive sit-down interview with Dr. Tyson, and we'll go into an actual cataract surgery and see everything, even a lens implant.
Do you know what the colored part of the eye is called?
Is your life a bit out of focus? Dr. Tyson and his team at Eye Associates can help. Call today and make your appointment. 800-922.
Do you ever stop and think about how much you love your eyes? Probably not. If you are like most people, you probably take your eyes for granted. You put your eyes through the ringer, and still, your trusted friends are there to show you the way. But maybe you have been thinking about getting LASIK or having your cataracts removed, but the thought of eye surgery frightens you. We understand. That is why our #1 priority is you and your eyes. With over 30 years of experience, Eye Associates is one of the country's most trusted eye specialists. The doctors at Eye Associates will make sure your eyes are cared for, and our friendly staff will go out of their way to make your experience peaceful and stress-free. Don't be confused by cheap imitators or too good to be true offers. Call Eye Associates and schedule your consultation, because your eyes deserve the best.
The colored area around the pupil is called the iris. It controls the size of the pupil and can be various colors depending on the person.
I'm here with Dr. Sidney Tyson. He's ranked as one of the top 100 surgeons in the United States, a member of the prestigious American Academy of Ophthalmology, and owner of Eye Associates. Hi, Dr. Tyson.
Hi, Lisa. I'm excited to hear what questions you have for me today.
Well, first, can you tell me a little bit about Eye Associates?
Well, Eye Associates is a multi-specialty eye care group, which consists of 10 professional doctors and 5 convenient office locations for our patients. And we take care of all types of eye disorders, from LASIK to cataracts, second opinions, and of course, routine eye care.
How long have you been practicing here in the Vineland area?
You know, Lisa, it's hard to believe, but it's been 20 years that I've been practicing here in the Vineland area. Patients have given me the privilege of taking care of them.
What would you say makes your patient process different?
I would say it's kindness. We treat patients like they're family members. So we want them to be comfortable, relaxed, and well educated about their eye care issues.
You have monthly community learning sessions. What happens in them?
Well, yes, we do. We call them Cataract Coffee Talks. So in those coffee talks, we are educating patients about the whole cataract process, because frankly, patients don't really understand about cataracts and cataract surgery. So we make every effort to educate them and answer all their questions so they're nice and comfortable and relaxed for the procedure.
Do you think that helps prospective patients feel more comfortable with eye surgery?
Oh, absolutely. I mean, knowledge is power. And with knowledge, patients are much more relaxed and stress-free for their procedure.
So you'd say patient education is important to you.
Oh, absolutely. And not only that, we go beyond that. We have live cataract seminars. We teach patients online with our website so that they can educate themselves anytime, any place, and we're always available to answer their questions.
What would you say is the top concern of prospective patients?
Lisa, I have to say it's fear. Everybody's afraid of having their eye touched or having the surgery. So our goal and our task is to make patients relaxed as much as possible. We have a friendly staff, they're well educated, and we give patients every opportunity to have their questions answered before surgery.
After surgery, what's their reaction to that concern?
Universally, why was I afraid? That's what they ask themselves after surgery. Because the whole process is so streamlined for patients. They're so comfortable, they're relaxed, and actually they're seeing much better right after surgery.
Can you tell me a little bit about the cataract procedure?
Think of the cataract like a camera, a lens of a camera. We have a lens and we have film in that camera. So the lens of the camera is what the cataract is. It's a cloudy lens and it doesn't focus light properly on the film of your eye, which is called the retina. So what we do in cataract surgery is we replace that cloudy lens with a new one. And we have lots of options about what type of lens that we use for patients.
And what about the lens placement? How does that work?
Well, we have so many different varieties. So if patients want to be able to see well at distance, that's one type of lens that we use. If they want to be able to see well at distance and near, that's a multifocal lens, we call it. We can use those types of lenses. Or if patients have astigmatism, we have special lenses for that. And so you know, astigmatism means that the shape of the eye, the cornea, is shaped like a football instead of a basketball. Many patients think it's some kind of eye disease of some kind, and it's not. It's just an unusual shape to the cornea which distorts vision. So we have special implants that can correct that and allow patients to see clearly.
So the patients can see better right away after surgery?
Well, not exactly right away. You got to remember that the pupil is a little bit dilated, there's a little bit of inflammation, so it takes a day or two for vision to start coming in more clearly. So they can see, but it's a little on the fuzzy side. So with time, in a few days, patients are starting to see more and more clearly, and day by day continues to improve.
How do they react to that?
They're ecstatic, universally very happy. And I would have to say, for the most part, they will tell me that they are able to see things that they've never been able to see before, especially those little things in the house called dust bunnies, where for the first time they're able to see dust in their house, and now I've had them clean up that they've never had to clean up before.
Wow, that is amazing. Thank you for your time, Dr. Tyson. When we get back, we'll go into an actual cataract and lens implant procedure with Dr. Tyson here at Eye Associates.
Do you know what your pupils do?
Call today and make your appointment. 800-922-1766. That's 800-922-1766.
Do you ever stop and think about how much you love your eyes? Probably not. If you are like most people, you probably take your eyes for granted. You put your eyes through the ringer, and still, your trusted friends are there to show you the way. But maybe you have been thinking about getting LASIK or having your cataracts removed, but the thought of eye surgery frightens you. We understand. That is why our #1 priority is you and your eyes. With over 30 years of experience, Eye Associates is one of the country's most trusted eye specialists. The doctors at Eye Associates will make sure your eyes are cared for, and our friendly staff will go out of their way to make your experience peaceful and stress-free. Don't be confused by cheap imitators or too good to be true offers. Call Eye Associates and schedule your consultation, because your eyes deserve the best.
The central opening of your eye is known as the pupil. It changes size depending on the amount of light.
It's time to go into surgery with Dr. Tyson. His patient, Agnes, has cataracts in both eyes and is eventually having multifocal lenses implanted in both eyes. Today's surgery is her first procedure. Let's join Dr. Tyson in the operating room here at Eye Associates Surgery Center.
All right, so we're going to get you all laid down and get ready for everything. So all we're doing now is just putting a few drops in, a numbing drop, and then an antiseptic drop. And as you can see, Miss Love's fully clothed. All we do is put a little bouffant headdress on to keep her hair out of the way. And then we're just going to clean around her eye and the skin area because this is a sterile procedure. We can still talk to her, but she's completely comfortable and pain-free. So now we're just going to cover her eye to keep everything sterile. And we use what's called a speculum to keep her eye open. Then we bring the operating microscope into view. It's a bit of a bright light. So as you can see, we have the dome of the eye, the window to the eye called the cornea. Her colored part of the eye is called the iris. And the orange area in the middle of the eye, also called the pupillary area, is where the lens is located. Then we make the main incision. I want you to think of the lens of the eye like a grape. And what we're going to do is open up the skin so that we can gain access to the pulp of the grape inside. So we're making a circular opening, and then what we're going to do is irrigate inside the pulp with fluid to loosen it up. And what we're doing is just trying to get it to rotate as it's doing very easily for us now. The next part of the procedure is what we call phacoemulsification. And basically, it is high energy ultrasound with irrigation and aspiration of the material through the main port. So even though you can't see it, the tip is vibrating 50 to 60,000 times a second. And as we're making passes across the lens, it's removing them, breaking them up into many tiny, tiny pieces. And that lens material is being aspirated or sucked in through that main opening that I showed you. You can see the lens is relatively thick, but the ultrasound device is making short work of it. And now we're using a little higher vacuum to crack the rim of the lens to allow it to collapse on itself. Again, this is completely pain-free. Are you okay, Mrs. Love?
Yeah, I'm fine.
Great. So the lens now is completely gone at this point. So now, with the lens gone, we have to find a way to restore focusing power to the eye. If we left the patient just like this, she would not be able to see after surgery because her lens has been removed and now we have to replace that lens with an artificial lens. So what we're going to do now is we're going to measure with a special device called the Aura instrument, which is a technical device that allows us to precisely determine the power of lens that we're going to insert into the eye to replace the lens that was just removed. It's going to be completely dark in a moment, and this allows my instrument to focus in to the back of the eye and perform a measurement for me. So we have our measurements. We know that Mrs. Love has astigmatism, and many patients are confused about what astigmatism really is. And astigmatism is basically a shape of the cornea. When the cornea is shaped like a football instead of a basketball, you have what's called astigmatism. And what astigmatism does is it distorts your vision. So in surgery, what we do is we remove that astigmatism by relaxing the shape of the cornea, and in so doing, we relieve that distortion and improve the quality of a patient's vision. So this is where the football is bent the most. This is one tip of the football. This is the other tip. The laces, for purposes of this example, are in the middle. And now we're going to put the lens in. So again, for Mrs. Love, this is a special lens called a multifocal lens. And we're slowly releasing into the eye, and now it unfolds to fill in the space where her lens used to be. Then we remove all of this protective material. You can see concentric rings. They're little rings in this lens which function to split light in a way that it allows her to focus up close and far away. And at this point, all we do is spread a little bit of fluid, which serves to act like a glue, and that seals them up. And I'm going to get one more measurement. So with the lens in place, she can see the little red lights there much better, and it's taking its measurement. So we've got exactly what we need. The lens is in perfect position, and Mrs. Love is done. We want it to be an easy, relaxing experience for you, and pain-free.
Yeah, it was, absolutely.
And you can see that she's awake, talking, and we're going to get her up in a little bit after we put some drops in.
How did the actual surgery feel?
I knew something was happening, but you could not isolate any movements or anything. You could see things happening.
I thought that the level of the cataract thickness was just right. I mean, she didn't let it get too far along, because what we find is that patients are so afraid of surgery that they let their cataract get so hard and brittle that it's very difficult to remove. So we always encourage people, as soon as you begin to have symptoms, you should come in, because we don't have to wait till it's so-called ripe anymore. We can actually remove cataracts at any stage, as long as you're having symptoms that prevent you from doing the things you like to do.
I've only had a couple medical procedures in my life. This is the easiest one. It really is.
Didn't I tell you that going in?
Yeah.
What made it so easy?
I was relaxed, great staff. I found that there was nothing that came up that I didn't expect. So there was no pain.
A week later, Agnes had her other eye procedure completed. Just a few days later, she came in to speak to us about the whole process.
I had cataract surgery in both eyes, done by Dr. Tyson, and I had the premium multifocal lenses placed in the eyes. And I noticed an amazing amount of difference. This morning, I was able to read the newspaper without reading glasses and do the crossword puzzle. It made me feel awesome. It's just amazing.
As you can see, Dr. Tyson and Eye Associates not only care for their patients, but also get results. Feel free to call now and schedule your appointment with Dr. Tyson and his team to take the first step towards a better life and healthy vision.
You know, people always ask me about that picture out in the waiting room of me and my mom. Well, that picture is taken in Alaska, and it was a trip that I gave my mom because it was the first time she was able to go back to traveling after her cataract surgery. Her vision had steadily been declining, and I wanted to take care of her in a special way. And by offering her cataract surgery and being able to do her cataract surgery, she was able to take a trip of a lifetime. And to see her face after seeing all the mountains and all the vistas for the first time so clearly, it really made me very proud. And I feel that same pride every day with my patients here at Eye Associates.
Do you ever stop and think about how much you love your eyes? Probably not. If you are like most people, you probably take your eyes for granted. You put your eyes through the ringer, and still, your trusted friends are there to show you the way. But maybe you have been thinking about getting LASIK or having your cataracts removed, but the thought of eye surgery frightens you. We understand. That is why our #1 priority is you and your eyes. With over 30 years of experience, Eye Associates is one of the country's most trusted eye specialists. The doctors at Eye Associates will make sure your eyes are cared for, and our friendly staff will go out of their way to make your experience peaceful and stress-free. Don't be confused by cheap imitators or too good to be true offers. Call Eye Associates and schedule your consultation, because your eyes deserve the best.